Okay, so for the next section, it's your biochemical, clinical, and injury. So I suppose these might come within different sections, but I'm grading them together. So what do I want to see here in order to get the grades? So as part of the ABCDE method of information gathering, the B stands for biochemistry. So you might ask your athlete, have they got any recent bloods? And if they don't, then document it. Say no recent bloods available. A lot of people do go to their doctor and get their bloods done. And depending on the age of your participant, there's a good chance that they've had their bloods done and they could say, oh, yeah, actually, I do have high cholesterol, or yeah, my iron was low last time I was with the GP, or some relevant information. Or they might say, nope, I have had my bloods done, but nothing, no one ever said anything. Or so that's a question to ask and then document the answer. The next one is current relevant illnesses. So now we're on to clinical. So you want to ask your participant, do you have any existing illnesses? So if your participant says, I have asthma, that might be important for your exercise intervention. If they said, I have eczema, skin condition, that, unless they tell you that there's a dietary trigger, which there may or may not be, that's not relevant. So the eczema, so you don't need to document that. You just need to document relevant illnesses. So again, hypo or hyperthyroidism would be relevant, because that affects our energy expenditure. Diabetes, cardiovascular disease. There are a few relevant ones, but it's up to you to identify, is it relevant or not relevant. That can be difficult sometimes. But for most athletes, you'll find that they don't tend to have much of an illness history. Injuries past and present. So for your exercise intervention, more than for my nutrition intervention, that tends to be pretty important. Yeah, can be useful. Again, for your exercise intervention, you're going to need a PAR-Q. Potentially worth asking about any allergies, dietary allergies, and again, documenting. And some simple questions on gut health can be useful. People don't like to talk about constipation, diarrhea, or bloating, but when you ask them about it, you'll be surprised that there are often issues. So including that as part of your questionnaire can be useful, because gut health issues are quite common and they can impact then your dietary intervention. One more thing to consider here in the clinical would be, if you're working with a female athlete, do they have regular menstruation and are they on hormonal contraception? So they're important things to document as well. If you identify that they don't have regular menstruation, then you're going to be questioning, right, do they have low energy availability or REDS, and potentially doing a follow-up questionnaire for that.